In recent decades, the health of people around the globe has improved significantly and life expectancy has increased. Ukraine is also introducing comprehensive healthcare reform, including revitalizing primary healthcare, modernizing health financing arrangements, and restructuring health services provision. However, the COVID-19 pandemic has shown the vulnerability of global healthcare systems. Diseases have no borders, so taking a consolidated effort is becoming increasingly important. For now, to achieve the Sustainable Development Goals by 2030, countries need to accelerate its progress and ensure that it is measured correctly. The partnership with stakeholders at the international and national level can help countries move forward to overcome disease and promote health.
Just to think from where we started, we had this discussion together with the Statistical Service, as well with the Ministry of Health, other partners, that let's think where we have got in 5 years implementing SDGs and where we are going in the future. Because what is very often said, what gets measured gets done. So it's very, very important to see how we measure, what we measure, and how we progress further. Another aspect, as we have been already for more than 1 year through the COVID outbreak, which is something which is devastating, and my condolences to many who have lost their friends or families, or who their friends and families are suffering. So, but only together we get through it. But at the same time, when we have a COVID outbreak, we shouldn't forget why we talk about sustainable development and where we wanted to get by 2030. So together with IHOR, we had this thinking that while we are going through it and while we cannot meet face to face, we do it virtually to ensure that we don't lose the sight where we want to go by 2030.
Aiming at establishing such a partnership this year, the World Health Organization in Ukraine, together with the State Statistics Service of Ukraine and Vox Ukraine, organized 4 webinars on how to select and measure the health-related sustainable development goals. As part of the events, the WHO experts presented the report Towards a Healthier Ukraine, Progress on the Health-Related Sustainable Development Goals 2020. This report summarizes Ukraine's efforts to transform its healthcare system and offers recommendations for improving the health of all Ukrainians. This report was developed as a part of the initiative of International Organizations Partnership, the Global Action Plan for Healthy Lives and Well-being for All, bringing together 13 multilateral organizations with expertise in health, development, and humanitarian work to support countries in achieving the health-related sustainable development goals. The geography of webinar participants also emphasizes the relevance of international cooperation in the field of healthcare. Experts from Finland, Ukraine, the Kyrgyz Republic, Moldova, Thailand presented their reports. The following organizations joined the discussion: the WHO Regional Office for Europe and the WHO headquarters in Denmark and Switzerland, the WHO Country Office in Ukraine, State Statistics Service of Ukraine, Ministry of Health of Ukraine, Secretariat of Cabinet of Ministers, United Nations Economic Commission for Europe, the United Nations Economic and Social Commission for Asia and the Pacific, UN Resident Coordinator Office in Ukraine and Kyrgyzstan, Ministry of Health, Labor and Social Protection in the Republic of Moldova, Eurostat, Analytical Center Vox Ukraine and others. Their experience and approaches to working with data and monitoring and measuring progress toward meeting the Sustainable Development Goals are undeniably valuable for Ukraine. It is crucial that the representatives of the Ukrainian authorities, in particular the Verkhovna Rada, the Secretariat of the Cabinet of Ministers, the Ministry of Health, and Ukrainian society showed a sincere engagement on the topic. Among the participants of the webinar, there were many representatives of universities, NGOs, Ukrainian offices of UN agencies. The events became a high-quality platform that brought together key stakeholders to discuss the issue with SDG achieving.
Важливо, коли ось та, вибачте, за таке порівняння, статистична руда, яку ми видаємо на гора, яку ми надаємо суспільству, коли вона використовується саме так, для аналізу і прогнозування. Я хочу, зокрема, зупинитися на тому, що з 16 індикаторів в третій цілі міцне здоров'я і благополуччя, 10 індикаторів розробляються безпосередньо Держстатом, 3 – Міністерством охорони здоров'я, 2 – Інститутом демографії і соціальних досліджень Національної академії наук України імені Птухи, 1 – Міністерством інфраструктури. Це командна робота. І ось саме такі події, вони дозволяють нам зібратися разом, обмінятися думками, ідеями, і спільно йти до цільових орієнтирів.
Healthcare systems should help everyone who needs help. To ensure this, detailed data and openness to dialogue on the part of the authorities are required. An important step in building a common understanding of the key healthcare challenges can be Ukraine's implementation of global SDG indicators relevant to our country. This will make it possible to speak the same language with other countries, as well as coordinate efforts more effectively to achieve good health and well-being. Only together, in close cooperation and leaving no one behind, will we be able to gain momentum and achieve the desired goals by 2030.